Hello, my name is Arnaud Kaze. I'm one of the physicians here at the Sovah Health in Danville. I've been working here at Sovah for the past 7 months. So I started here in August in the middle of the pandemic. And the big reason why I chose to become a physician is because I've always felt this need that I needed to do something that could be meaningful in people's life, and also to try to have a meaningful impact in the community in general. So that's basically why I decided to go in the medical field. And why did I choose to come to this community? Because I grew up in a small town, which was kind of similar to Danville. And also, the staff here at Sovah Health Danville is very, very approachable, very easy to work with. Everybody's nice. And yeah, that's pretty much why I chose to come here. And I love it. Now, I would like to provide some update about the status of COVID-19 cases in our hospital and across the 2 campuses. So as of this morning, we have 19 COVID-19 cases. That is patients who are currently admitted at both campuses. We have 10 patients at the Sovah Health campus here in Danville, and then we have 9 at the Martinsville campus. So this is significant because it is a decrease from the last update that we had. I believe last time it was 41 cases. So this is, I think, encouraging news. However, I would like to emphasize that we need to remain vigilant. Now I would like to address our visitation policy. Before I start, I would like to mention that we at Sovah Health, we realize how important it is for patients who are admitted to have their loved one visit and be at the bedside with them in times of illness. Having said that, unfortunately, there have not been any major change in our hospital policy over the past few weeks. The visitation level is being assessed weekly based on the COVID-19 spread in the community. In case you have any question or you need any further information about our policy, I will invite you to visit our website at sovahhealth.com for more information. So let's move on to some good news, the COVID-19 vaccine. So I am happy to share that Sovah Health has been administering the COVID-19 vaccine to the frontline workers as well as individuals in category 1B as defined by the Commonwealth of Virginia Department of Health. And to date, Sovah Health has administered over 17,500 doses of the COVID-19 vaccine. I would like to invite you to be patient. Once we receive additional vaccine, more clinics as well as community vaccination event will be scheduled. And we will continue to work hard to ensure that both communities that Sovah Health serve are fully vaccinated and protected. March is Colorectal Cancer Awareness Month. Yay! No, seriously, we all have a colon, okay? And I think it's very important that we do take care of colon as any other organ. And unfortunately, colon cancer is very common and it can affect both men and women. However, most colorectal cancer do start as polyps. And this is why I would like to emphasize on the importance of getting a colonoscopy done, because during colonoscopy, those polyps will be identified and they can be removed, and that will therefore prevent the occurrence of colorectal cancer that would later would have caused our death. So early detection of those polyps or of colorectal cancer can save lives, and one of the important tools that we have available to do that is via colonoscopy. So if you are 45 years or older, I would like to invite you to discuss with your primary care provider about the risk and benefit of getting a colonoscopy. So finally, I would like to conclude by reassuring everybody that it is safe to come to the hospital or to the emergency room if you need care. So one thing that we in the hospital have realized is that over the past few months with the pandemic, many individuals who have serious illnesses like heart attack or stroke are reluctant to come to the hospital because they are afraid to catch the virus. I would like to say that COVID-19 represents only a small proportion of cases that we have, and our staff is taking all the precautions to make sure that those patients are properly isolated. So if you experience any concerning symptoms like chest pain or shortness of breath or anything else that's concerning enough, please call 911 or go to the emergency room to seek medical care. Additionally, please do not delay your primary care visit or your normal checkups just because you are afraid of the virus. All the clinics are taking all the precautions that are necessary to make sure that you do not catch the virus. And thank you so much for listening.